Hi, I'm Dr. Kivett in Santa Rosa, California. I'm a plastic surgeon and dermatologist, and I wanted to speak to you today about squamous cell cancer, which is also known as squamous cell carcinoma. If you've been diagnosed with it or worried about having it, we can talk about that today. You're not alone, certainly. 1.5 million Americans a year get the squamous cell carcinoma, and for the most part, unless it's in some unusual area or if you're immunosuppressed, you're going to do just fine. Now, squamous cell carcinoma can have a number of appearances. You can simply have a small pink bump that's either crusty or rough. You can have a flat patch, which is red and rough. You can have a dome-shaped bump that grows and may bleed, or you can have simply a sore that doesn't heal, or it heals and then returns. There are a number of things that precede having a squamous cell carcinoma, and those can be on any part of the body, but especially in areas where the sun has hit. For example, the head and neck, the arms, especially the left arm, because that's the car window side, but other areas as well. Now, some squamous cell carcinomas start as what we call actinic keratosis. And actinic keratosis is a bump that has a slight scaly patch on the top of it. And the patient will come in discussing the fact that the little scale that sticks up falls off every couple of weeks and then it regrows. And so about 5% of those eventually become full-on squamous cell carcinomas. But the actinic keratoses, sometimes called AKs, will be problematic and can be treated. Now, anybody can get squamous cell carcinoma, but it's mostly more common in people who have light-colored skin. Everyday activities expose you to the ultraviolet rays, especially ultraviolet A and ultraviolet B, and these cause the skin to slowly change. It's important to realize that the radiation that we all get in contact with will foster the growth of these early changes. It's been said that you sustain 75% of your lifetime skin cancer changes in the first 18 years of life. Now, people don't realize it, but the studies have shown that any kind of short exposure to the sun is simply additive to your lifetime radiation dose. So, you go out in the backyard, dump the trash, feed the dog, go to the mailbox, leave the car and go into the mall. All of these little things add up. So, it's fair to say that 60 1-minute exposures to the sun is identical to the skin to one 60-minute exposure to the sun. Now, this doesn't mean you have to go live in a cave in Alaska or something like that, but you have to be aware that these things can take place. Now, the risk of developing squamous cell cancer increases if you have pale or light colored skin, if you have light eyes, blue, green, or gray, if you're blonde or have red hair, or if you simply are not able to tan very well after trying to. Life, work, experiences, sports, um, all those things contribute to you getting sun. Exposure to cancer-causing chemicals like arsenic in drinking water, coal tar, some insecticides or herbicides, tobacco, all of these things contribute toward the potential for squamous cell cancer to grow. If you've had a bad burn, meaning a thermal burn, a burn from a flame or a campfire or some other injury of any kind, whether it's a cut from a barbed wire fence or it's some other cut from a car accident, those tissues years later can result in the growth of a squamous cell cancer. If you're an organ transplant recipient, your immune system has been suppressed. If you have diabetes, your immune system doesn't work as well. If you're on cortisone or some other drug that helps your joints not be so inflamed, all of these things contribute toward having squamous cell cancer. If you're taking medications that increase sun sensitivity, that will also contribute, not as one pure factor, but as one of a number of factors. One drug that's commonly used that makes people urinate so that it lowers their blood pressure is called hydrochlorothiazide. Now, in terms of treating squamous cell cancer, first of all, a biopsy has to be done in order to diagnose it. And so, your doctor, whether it's your family doctor or a dermatologist or your plastic surgeon, will need to do a biopsy, and that's usually easily accomplished. The fingers of the doctor can be squeezed around the area, and then the uh, Novocaine slowly, carefully, and almost painlessly introduced into the skin will render that area numb. And then after a brief period, the spot can be shaved off or in some other way sampled. And then once that tissue gets sent to the microscope, within a couple of weeks, the pathologist will be able to give us a result. And many times, something that's thought to be squamous cell cancer really isn't. So that's why a biopsy has value. Now, in terms of treating squamous cell cancer, there's a number of ways that this can be done. First of all, standard excision, that is to say, simple removal of the cancer itself with removal around the margins, the edges, and then sutured up. And then you'll have a result back in a week or two from the pathology people telling you that the lesion was removed. Sometimes there's a problem with that particular aspect of it, in that it's thought to be, if you want to think about it as removing a piece of raisin bread, and then the pathologist will do 7 or so representative slices of a vertical nature through it, and then report to you that there was no cancer left in it. Now, the problem with that is that if it were a raisin bread, then what happens if, in taking the 7 slices, the pathologist misses one of the raisins? You get back a report saying the cancer is removed completely, but it's not. So that's part of the problem with that. So the report comes back either it's completely removed or not. You can't always believe that necessarily. There's another technique that was developed by Dr. Fred Mohs in 1935. And over a period of about 60 or 65 years, he treated hundreds of thousands of people with his technique. And he simply converted the idea of these vertical sections to horizontal removals, so that when the specimen is removed in a surgical suite, the tissues are removed um, from the bottom and from the edges. And so if the tumor is present at the bottom, then we simply just remove another layer while you wait. So by the end of the day, when your work is done, the cancer has been removed in its entirety. The potential impact on the function of the area and the healing of a wound has been dealt with, mostly with stitches. And then the cosmetic aspect has been dealt with as well, for the most part. So Mohs technique has a very good track record, has much less regrowth of a tumor in a given area. Radiation is used in some patients who are not good candidates for surgery, and there's a series of radiation treatments that destroy the cancer cells. One of the reasons for its not being highly popular is that, in spite of the superficial quality of the destruction of the cancer, there's still a problem with um, damage that's residual from the radiation. So, should a tumor that's outside of the area but next to it uh, grow, then the next doctor who's trying to remove that tumor now has to deal with permanently damaged skin. And in terms of healing, blood flow, and so forth, it's just not as good a quality of skin. Um, there's another technique called curettage and desiccation. And what that means is that a particular lesion is scraped, numb of course, already, and then you use an electric pencil to kind of dry it up. And that's a technique that's been used for hundreds of years, and it seems to work pretty well. The problem is you end up with a scar, plus you're not sure if the cancer is completely gone. Now, some farmers, for example, who are on their tractor every day of their life, will come in with 20 or 30 of these on their arms. And so frequently that person will say, I don't care, doc, just go ahead, scrape them off and burn them. Whatever grow back, we'll accept, and then we'll come back in and see you. So it does have its application in certain places. There are also chemotherapy or immunotherapy creams that can be used to destroy the cancer cells. They haven't caught on quite as much as other techniques, but they're reasonable. And then there's oral medicines that have recently been approved for by the FDA to take in some limited situations. Now, if you have squamous cell cancer, then you have a much higher risk of the of having another squamous cell cancer. So it's a multiple uh, risk. So that in that sense, you have to always have follow up with your family doctor or your skin cancer specialist, who's routinely a dermatologist. And so, what also helps is that if you can perform self examinations, on your birthday, for example, tie it together with the idea that if you, in your privacy of your home, get into your birthday suit and look at every single area, and if anything looks odd, if there's something that we call the ugly duckling, then you can put a circle around it with a marker pen, and that's the spot you come in for. And you can also trust the doctor to look very carefully at all of your skin lesions. So if you notice any new spots, something that looks different from the rest, some spot that's itching and bleeding, or is just not going away, go in and get it checked. Your body deserves that. You treat your car sometimes better than you treat your own body. Now, if you protect your skin every day, that's going to make a difference. I'm not saying go live in a cave in Alaska or anything like that, but some real sensible points are not that difficult to do. Certainly, shade alone will help, particularly between 10 a.m. and about 2 to 4 p.m. Sun's rays are the strongest. So if you can do some of your work, your sports, yard work, whatever, before that time, before 10 a.m. or after 2 to 4 p.m., you're just going to be better off. Sunscreens are good. Um, I'm not a huge fan of putting lotions on my face. Some people are okay with that. Um, I prefer the spray that's not sprayed directly onto the skin, but rather sprayed onto the fingers and then put selectively onto the skin of the face and the head and the neck area. The studies have showed that if you just take a can and spray it toward your face, a lot of it's going to go anywhere except where it needs to go. Um, a sunscreen of about 30 or 40 or 50 or 60 SPF, meaning sun protection factor, will protect you from about half the rays. Um, so that means half the rays are still coming through. And so you have to be extra cautious around water or snow or sand or a sidewalk or the hull of a boat because of that reflectance under a hat, which I strongly encourage, and not just a baseball cap, but a wide brim hat. And there's some very stylish ones out there. Protective clothing is going to be your best friend. You're not buying it in a bottle every month, and you'll find that you're actually cooler with long sleeves, even in the summertime. Just look around at the people mowing the lawns in hot weather. They do it not for sun damage, but they do it because you're actually cooler when you perspire, and in a light cotton cloth, then it keeps you cooler. And then, of course, um, you need to be having sunglasses if you possibly can. So, tanning beds are a real problem. I strongly recommend that you don't use those. Um, if you have a history of any kind of uh, venereal disease, or you have exposure to HPV or human papillomavirus, then it's important to consider getting the vaccine. Limiting the amount of alcohol and nicotine, particularly, greatly reduces the risk of having squamous cell carcinoma in the mouth and throat area. And if squamous cell carcinoma is going to do anything to you of a serious, serious nature, it can easily arrive from that location. So I hope this has helped um, to increase your knowledge of this situation. It's good to be in touch with your patient health advocate, namely your doctor, dermatologist, plastic surgeon, to help avoid a problem such as this. So if you liked what we had to say today, if you want to give us a thumbs up, that would be great. If you want to leave a question or comment for us, we'll try to answer it for you. Be sure, if you would, to say to your friends to consider looking at these videos, and even consider subscribing so that we can continue to provide for you information that will benefit you. Thanks for listening. Have a good day.